Alright, first we're going to apply the emollient. This helps lubricate the skin a little bit so there's no pulling or tugging on the actual skin itself. It also has vitamin E in it, so it helps enrich the skin and loosen up that scar tissue a little bit before we treat it. Alright, so believe it or not, this swelling here has gone down significantly since we started. But we are going to kind of work around this whole scar tissue area here, and then we'll move on to the other scar on the more dorsal side of the foot. So basically we're just going to do almost like a cross friction massage across the line of the scar. And typically we found that this front part of the scar is a little bit more adhesed, or a little bit more tightly connected to the underlying tissues. So if she jumps or moans or whatever, it's just because that's the more hypersensitive area of this particular scar. Good. So basically we would do this, just kind of loosening up the surrounding tissues, and then we would also perform the scar release technique, where we're going to try and bring the tool under the scar and lift the tissue away from the underlying tissues. Lift the skin from the underlying tissues. And this was repeated for, not too long. The patient, obviously, we don't want her to be so uncomfortable, so we only treat for the amount of time that we feel that we've made a little bit of progress and that the patient is able to tolerate the discomfort. Okay? Thank you so much.